Heart attacks, diabetes, and obesity are rising sharply among young people in India, with over 14 million children and teens now overweight or obese. This trend is worrying and calls for immediate action. One major reason is unhealthy eating habits. Many young people consume too much fast food, sugary drinks, and snacks, which are high in calories, unhealthy fats, and sugar but low in nutrients. These poor dietary choices lead to weight gain and increase the risk of obesity, which is a major factor in diabetes and heart disease. Another problem is the lack of physical activity. Many young people spend hours on screens and live a sedentary lifestyle, which adds to weight gain and health problems. A lack of awareness about health and skipping regular checkups also make things worse. Regular health screenings can catch problems like high blood sugar or cholesterol early, making it easier to prevent serious conditions. To address this, it's essential to promote regular exercise, healthy eating, and routine health checkups. These small but important changes can help young people maintain a healthy weight, improve heart health, and prevent conditions like diabetes and obesity. Everyone, from individuals to families and policymakers, needs to work together to support healthier lifestyles.
Well, regarding this, I would say that as such, the time we list those cardiac problems, and particularly so, it is the coronary disease in particular. There are so many cardiac problems, but coronary disease, I think so, comes first. And that is coronary disease, I mean to say that patients getting heart attacks or anginas, and it is at the dead of the night, you find that you suddenly wake up with chest pain and subsequently you're rushed to the hospital. Now, so many people, I think so that what I've seen is that people as young as around 20 years of age would have been taken care in hospitals with heart attacks. And particularly so, it has been seen that for all the other risk factors, the things which come first in young people are smoking too. And these days, I think so that we should be talking about pollution also. That so much of pollution, it says that a person in Delhi, he smokes approximately around 40 cigarettes per day without he being a definitive smoker. So pollution and stresses, eating habits, more of fast food. So all those things, they lead to obesity. And obesity is indeed a big concern because people who are obese, the chances of them getting cardiac problems are definitely high. And so the time we see these patients, I think so, particularly that the younger ones, adolescents and all those things, and particularly patients who have got heart attacks in a younger age, maybe 55 years or less is what we call it means as a premature coronary disease. We tell the children that take care of the children, they should not really fall into this trap and get obese. So once they get obese, and then the whole cycle starts whereby you tend to get hypertensive, the chances of you becoming diabetic is high, and the physical activity per se is reduced these days because you just sit in front of any television or playing with the mobile, and at the same time you're being served with all the fancy items whereby you just increase your weight and subsequently you get hypertensive. And at times these are the risk factors which lead to heart attacks. We have seen heart attacks in people coming from the villages. They have who are working endlessly in the fields and subsequent and not smoking too. So see, these are all risk factors. It is not necessary that you have to find a risk factor in a person who gets a heart attack. But these are all risk factors whereby if a person is obese, if a person is a smoker, or is a diabetic, or is a hypertensive, the chances of his getting a cardiac problem definitely increase. And obesity in particular, as what you asked me, that if there are any new interventions, yes, there is a lot of talk about obesity. There are new medications which have come up, and these medications have been seen that they decrease the weight significantly. And at the same time, the whole profile, your BMI comes down, and you tend to be normotensive, that is, your blood pressure tends to remain under control. And you are more active because the time you're less obese, you tend to really start walking around and you are physically more active. So all these things put together, it definitely decreases the chances of you getting a heart attack. So it is very important that obesity and these new medications which have come up, they are being talked around a lot, and there's so many trials which are going on all these new medications whereby they can bring down the weight.